Hello, guys. How are we doing today? Welcome to Health Matters with Dr. NG. Um, we've been talking about diabetes all this while. I want to quickly tell us some things about diabetes before I talk about the complications. And what I want to tell us today about diabetes is some people ask, can I prevent diabetes? Is it preventable? Is there something I can do to help myself? Because we know diabetes runs in families. So oftentimes people develop it because the gene is there, is in the family. Yes, it runs in families. So there are some things you can do to help yourself. Yes, there are some things you can do to at least prevent yourself from getting it or getting it early. One of them is exercise. Okay, you try to exercise. Sedentary lifestyle is not good because you know that it makes people become obese. But when you exercise, when you lose weight, when you watch your diet, these are some things you can do to help prevent diabetes or prevent the progression. Okay, because when you keep a healthy diet, when you take a healthy diet, you exercise, and you lose weight. If you're on the big side, okay, you drop that weight. These are some of the things you can do to help yourself, okay, or to prevent it, or to make it not to be so severe when it comes. Okay, assuming you have already been diagnosed of diabetes, yes, these things can also help. Then cut down on alcohol, because you know alcohol at the end of the day is broken down to sugar. So cut down on alcohol, exercise, lose weight, increase activity. That's exercising, okay. So exercising here doesn't basically mean that you have to um be involved in vigorous exercises. For some people that are a bit advanced in age, you can just do brisk walk every day, 30 minutes every day for 5 days. At least that's the standard. Okay, if you can do brisk walk 30 minutes every day for 5 days, that's good of an exercise. If you can still add more activity to your everyday life, it's still fine. If your, let's say your bus stop is 10 minutes away, and you stop here and walk down, do the 10 minutes walk, okay, instead of driving down to the shop, to the mall, to anywhere you go to your driving, you can decide to like park the car and take a walk. Walking is a very good exercise. I mean, if you cannot really be, or for some people that run a very busy schedule, that they might not have the time set aside to go to the gym or to get into the streets and really do the exercise, you can increase your activity level, okay, on daily basis. So these are some of the things we can do. Keep a healthy diet, portions of fruits and vegetables in your food, okay. Cut down on carbohydrates containing foods, so that you reduce the work you're giving the pancreas, because you know when you eat carbohydrate food, the pancreas will have to produce insulin, and the whole cycle, I explained this to us, will start all over again. So these are just some of the things you can do to help yourself. In case diabetes runs in your family and you want to see how you can prevent it, these things can help. In case you're already diagnosed with diabetes and you are thinking of how you can help yourself and make it not to be worse, because if you already have diabetes and you are obese, you are living a sedentary lifestyle, that's your activity level is low, and you're not eating a healthy diet, you're eating junks, a lot of fast foods and junks, you are worsening the situation. So these are some of the questions I got. I decided to just address them, okay, and talk about them before I now tell us the complications. So in the next video, I'll be sharing with us the complications of diabetes. That means what are the things that can happen if diabetes is not controlled, or if diabetes is not diagnosed on time. So look out for that video. Bye bye.